Are you working on any new books, TR?
I am writing another book. Yeah, I'm about a third of the way through. It's a book about the 1960 presidential election, and basically Mayor Daley and Joseph Kennedy stole Illinois for the Democrats and won the election.
Wow,
So,
that sounds interesting.
oh yeah, that's it. Thanks. Yeah, I hope so. I've been wanting to write this book for about 25 years, and every time I started, I got a contract to write another book, so I didn't do it. And then my last book, I did a book about tax policy, taxes around the world. And I just want to point out, this book got very good reviews, but it didn't sell a copy. It was a total flop. And therefore, no publisher is coming to me for another book at the moment, so I can finally write this book I've been planning to write for 20 years. So,
well,
what is your tax book called?
what's my tax book is called A Fine Mess. A Fine Mess. Like Laurel and Hardy, here's another fine mess.
Right.
The publisher didn't want to put tax in the title because she thought nobody would buy the book, and as a matter of fact, nobody did buy the book. So, fortunately, or I don't know, is it fortunate? Random House paid me a lot of money for that book, so they took the hit, and that's, I think, one of the reasons nobody's interested in another book from me at the moment. So
maybe you should have called it "Why You're Paying Taxes and the Mega Rich Aren't."
I know, that's what the book's about. That's what it says. We're getting shafted, and also other countries have made it simple. I was in Amsterdam on March 30th one year with a friend of mine, and he said, "Oh, gee, you know, that my tax returns, state and local, are due tomorrow. Let me just take 15 minutes." And in 15 minutes, he did his 2 tax returns. And in Japan, the IRS figures out your taxes for you, and they send you a card, and they say, "We think you made this much. We think you owe this much. We owe you a refund, and we'll put it in your bank account on April 1st. And if that you agree with that, you're done. You don't have to do anything." So I have said to my friend in Tokyo, Togo, I had him help me with this book, and I said, "Shige, I want to see you fill out your tax return." And he said, "What do you mean fill out a tax return? They don't fill out it. The government does it for you." And I said, "God, you know, in America, people spend days or weeks gathering documents and filling out forms and making calculations." And Togo says, "Well, why would anybody want to do that?"
yeah. So we're going to talk about something like that here shortly. I think we'll go ahead.
Exactly. What a mess our healthcare is. Yeah. So.
Yep. All right. So thanks everybody for attending our club luncheon. The goal of the club is to bring together all Democrats, from the most conservative to the most progressive, to celebrate our shared values, appreciate who we are, and to work together to put more Democrats in office. And we may also have some attendees for today's luncheon who are not Democrats, and we welcome them also. I'd like to mention our club luncheon sponsor, Albrecht & Albrecht Law Firm, has been supporting this luncheon for several years now. So if you need legal help, please think about Albrecht & Albrecht. Our program today will feature TR Reid. He'll be talking to us about the task force that was created by the Colorado Legislature in 2019 to investigate the cost of 3 different ways of paying for healthcare. Before we get started on that, everyone is asked to stay muted except for the speaker, myself, and Karen Pontius, who will be handling questions. So if you want to submit a question during the luncheon, please use the chat feature on Zoom. Please do not unmute yourself and speak. Send your questions to everyone in the chat window. So make sure that little drop down says everyone. If you're having trouble with your internet connectivity, you may want to disable your video. Audio only works better on slower connections. This Zoom meeting is being recorded and will be available within a few days for viewing. We've actually been able to get them out the next day for the last several months, so hopefully that'll happen. You can choose speaker mode, typically in the upper right corner, which will bring up a larger video of the person speaking. And of course, I'd like to encourage everyone to donate to the La Plata County Democrats. Monthly donations are particularly appreciated, and you can set those up on ActBlue. Monthly donations make it easy for you to give to the party with relatively little pain. This is our 9th Club Luncheon for 2021. The Club Luncheon Committee has been working to bring some great programs for this year. And our speaker next month will be County Commissioner Marcia Porter Norton, and she'll bring us up to date on some of the issues in La Plata County. And this November, the November luncheon will be the last one for 2021. We don't typically do a luncheon in December or January. If anyone has any other announcements to make, please enter something in the chat window and we will recognize you at the end of the luncheon. Now to our speaker. T.R. Reid has become one of the nation's best known reporters through his books and articles, his documentary films, his reporting for the Washington Post, and his lighthearted commentaries on NPR's Morning Edition. His book, The Healing of America, A Global Quest for Better, Cheaper, and Fairer Healthcare, was a New York Times bestseller. You might want to hold that up, TR.
I got it. Yeah. Makes great Halloween giving if you've been worried about what to. There it is.
It shows how all the other industrialized democracies have achieved something the United States can't seem to do, which is to provide health care for everybody at a reasonable cost. TR recently served on the task force that was created by the Colorado Legislature in 2019 to investigate the cost of healthcare in Colorado under 3 different scenarios. The task force commissioned the Colorado School of Public Health to produce the report, which was released at the beginning of September of 2021. So Mr. Reid will be discussing the task force and the report and giving us an inside look at the results. Let's give a big virtual welcome to TR Reid. Go ahead, TR. It's all yours.
Hi, everybody. Well, I'm quite pleased to be back in La Plata County virtually. I certainly wish I were there physically. I love going down there. Last time I came down, and I think I addressed La Plata County Dems and about our ballot initiative to get health care for everybody. I had a wonderful time. We came in March. I skied Purgatory 2 days, stayed in the Strater Hotel. I just had a great time in Durango. So please invite me back during ski season. I'll come again and give a talk about something or do magic tricks or whatever you want. But today I'm here to talk about, as Gwen said, the Task Force on Healthcare Cost Analysis. This was a think tank, sort of, or a study group that was created by the Colorado Legislature in 2019. And the reason was to deal with some fundamental problems in healthcare in Colorado. So let me just start off by talking about the state of healthcare in the state of Colorado. Generally, the news is pretty good. I mean, we're a healthy state. According to the Commonwealth Fund in New York, they do these comparative studies. They rated us as the 6th healthiest the 6th healthiest state out of the 50 states. Hawaii, for some reason, came in first. I guess all that surfing is good for you or something, but we rated 6th. We were certainly the healthiest of all the Rocky Mountain states. And in some important areas, as you may know, Colorado ranks first among the 50 states. We have the lowest rate of obesity among the 50 states, which is an important health indicator. And I'm afraid I have to admit that's not due to pudgy old guys like Gwen and me. It's because we keep importing these kids who want to ski and climb mountains, and they're very svelte, and therefore they keep our average obesity rate quite low. So we're number 1 in that area, but really healthcare in Colorado is quite good. And we have a lot of fabulous hospitals. Millions of people in Colorado are getting world-class care in world-class facilities. That's the good news. But there are problems. The main problem is we just leave out a lot of people in Colorado, and particularly on the western slope and down in southwest Colorado where you people are. Just a lot of people don't have access to the fine health care that you can get elsewhere. About 350,000 Coloradans, maybe 360,000, have no health insurance at all. No health insurance. And that means basically they don't go to the doctor, and when they do go to the doctor, they go to the emergency room, which works temporarily. It's not a place to get continuing health care. And also the emergency room is the most expensive possible way to provide health care. And these 350,000 people, that's all they've got. And then about twice as many Coloradans, another 700,000 or so, do have insurance, but they are what's known as underinsured. Underinsured means you have insurance, you pay the premium every month, but you never use the insurance because the deductible or the copay is so high that you never get any benefit. So if you take a family of 4 with a $5,000 deductible, and that's a pretty common plan in Colorado, they can't afford to go pay the doctor $150 for a visit, and therefore they don't go. So this is a real serious issue. And when you have people who are either uninsured or underinsured who can't go to the doctor when they feel sick, what this does is it makes illness worse, because over time that illness gets more severe, and then it makes it much more expensive. If they had gone to the doctor initially when they were first sick, that ailment could have been treated. The doctors call this early presentation, and it's a key to keeping populations healthy. If people say, God, $120, I can't afford to go to the doctor, then you don't get early presentation, and eventually they end up in the hospital. When I was doing my book on healthcare in other countries, the health minister of Britain gave me an example. He said, well, you take a 7-Eleven clerk or a hotel maid or a gas station attendant, and she feels kind of a vague pain on the right side of her abdomen. Well, without insurance, a vague pain, she's going to live through that. She's not going to go to the doctor. That would cost $100. Well, guess what? 4 weeks later, that infection has become a burst appendix. She's in the emergency room, and that's a $30,000 procedure, which could have been avoided if that woman had had insurance. So there's enormous both medical and financial value to providing insurance for everybody. This is the problem. And then here's one more problem in Colorado. While I said we have some excellent hospitals, they are really expensive. The hospital industry in Colorado is gouging us. According to the Commonwealth Fund in New York, we pay for totally standard hospital treatments like maternity, hernia repair, shoulder replacement, just standard procedures. We pay more in Colorado than 40 other states. We pay more than New Yorkers. We pay more than California, more than Illinois, more than Hawaii, those healthy people here in Colorado, because of the negotiating stance of the insurers versus the hospitals. The hospitals have a lot of economic negotiating clout against the insurers in Colorado, and therefore they can keep their prices high. So in 2019, the legislature and Governor Polis were trying to look for a way to deal with these problems with the people who can't go to the doctor, and with the fact that those of us who do go to the hospital have to pay through the nose. And they created a task force. It's called the Healthcare Cost Analysis Task Force. It's what it's called. And this was a bipartisan organization. The members were appointed by the governor and by both parties in the legislature. And I was a member of this because I'm an author on healthcare. And the membership was 2 Republicans and 2 Democrats from the legislature, 4 representatives from the relevant state offices, the health department, the healthcare and policy and finance department, which runs Medicaid, and organizations like that. And then just a few other people who use healthcare. An interesting thing about this task force that made it different from all the other study groups looking into this was that it was 80% women. And to me, that made sense because women are the big users of healthcare. And therefore, they ought to have a role in deciding how to deal with healthcare. So this task force sat down and we were directed by the legislation to look for the best way to provide healthcare for everybody in Colorado. That is to get those million people with no insurance or underinsurance, to get them decent coverage at a reasonable price. And the legislation even told us what to look at. They said we should study 3 models. One is the current model, which I described, where most people have insurance largely through their employer. There's Medicare, there's Medicaid, there's the VA, there's TRICARE for military people. And then, as I said, 350,000 people with no insurance. That's the current system. Then the legislation asked us to look at a mixed system of universal coverage where everybody gets insurance. Some get it in the private, from private insurers through their employer or through the Obamacare exchange or something. And the people who can't get it that way would then be covered by a government plan. That was model 2. And model 3 was a single government insurance plan that covered everybody up to age 65. And then after 65, people stayed on Medicare. And in that model, the payment would be run by a government organization, but the providers, the docs, the hospitals, the physical therapists, the chiropractors, the labs, drugs, that would still be private. That would still be the private providers we use today, but the payment would be public. So this is what we were asked to look at. And we were also asked to ask Coloradans, what do you want? What do you want from a healthcare system? And I thought we had several public meetings. I think a couple of people from Plata County took part. And we had a survey where we surveyed hundreds of Coloradans, and I think we got to 58 counties on that survey. So it's pretty broad. And here's what we found. We found that people think everybody should have insurance. We asked the question, do you think anybody who's sick should be able to go to a doctor in Colorado? Interestingly, about 89% of Coloradans said yes. If anybody in Colorado is sick or injured, they should see a doctor. But that leaves 11%. 11% of people in Colorado said you should only go to a doctor if you can pay for it. If you don't have the money, tough. That one kind of stunned me. I wouldn't have thought that. If you poll all Americans on this question, about 96% of Americans say everybody should have access to health care when they need it. In Colorado, at least among the people we surveyed, it was 89%, still pretty high. People said that they wanted access. They didn't want the insurance company picking the doctors they could see. That is, they didn't like these narrow networks that the private insurers have, where they say you can go to this doctor or this hospital. You can't go to Dr. Jones, but you can go to Dr. Smith. People don't like those narrow networks. They want to make the choice. They don't think the insurance company should choose who their doctor is. And they very clearly told us they didn't give a damn where the insurance came from. They wanted health insurance at a reasonable cost, and they don't care whether it was private or government. They didn't care. Just so they got insurance that was decent, gave them a decent price for the medical care they needed, and gave them choices. So I thought that was pretty interesting. We found people really wanted what we were set up to create, which is healthcare for everybody. So then we had to figure out how to do this job, how to study the 3 models we were asked to study. And the first thing we did was we hired a consulting firm to do what's called a literary search or a resource search. They looked at all the books and articles and movies they could find to tell us what we needed to know about healthcare. And I was not terribly impressed with these consultants for this reason. They gave us a list of 16 articles. They did include this brilliant book. I want to point that out. This is a great book on healthcare right here. They did include that, but they also included a movie that I made for PBS Frontline about how other countries provide healthcare for everybody. That movie is called Sick Around the World. I think you can stream it on pbs.org still to this day. It's also on YouTube. Kind of ticks me off that it's on YouTube because PBS sells DVDs of this movie, and every time they sell one, I get about 10 cents. So if it's on YouTube, I'm getting cheated because people can watch it free. I don't like that. But anyway, these consultants said, yeah, you should read these books or articles, and you should watch this movie, Sick Around the World, featuring J.R. Reid. J.R. Reid, they said, that's me. It's T.R. Reid. I mean, their own client, they couldn't get the name right. So I thought I was not impressed with those consultants. But anyway, so then we needed to find a group of consultants to do the major study, to look at the costs and the conditions of the three models. And we put out a request for proposal, RFP. We did this formally through the state mechanism, and eventually chose a group of public health scholars at the Colorado School of Public Health. Are you all familiar with the Colorado School of Public Health? This is a fairly new entity. I think it's 10 years old. For many years, Colorado didn't have a School of Public Health. And the idea was that CSU and CU would work together to build a School of Public Health. And everybody said, oh, those two, the twain shall never meet. They can't do it. But as a matter of fact, they did get together. They have a campus in Denver. They have a campus in Fort Collins at CSU. And so the Colorado School of Public Health is a going concern and is very valuable to our state. It's producing a lot of very highly trained, dedicated public health professionals. I'm sure there's some working in La Plata County right now. Anyway, we hired a team of experts at the Colorado School of Public Health to study the three models I told you about and figure out the best way to provide health care for everybody. And they came back, and I will now tell you what they found. I can't say it's a surprise because almost all studies of how to provide universal health care come up with a similar answer. Here's what they said. They said the current method in Colorado, where we have this big mix of public and private insurance plans, and then lots of people with no insurance and lots of people with insurance, that's not working. That decreases our health statistics. It increases cost because people, when they do go to the doctor, use the emergency room as their doctor's office. It doesn't really meet the need. So the current situation is really not a good way to provide health care for our state, or for that matter, for our country. Then they looked at the second model we were asked to, which, as I said, was a mixed system of universal insurance, where some people got private insurance either through their employer or on the Obamacare exchange, or they just bought an individual policy. And then people who couldn't afford that or didn't have access to that would be covered by a relatively small government insurance plan. That's called the mixed system. And they said, well, that would work. That would get everybody covered. That would mean people could go to a doctor early for early presentation. They wouldn't have to rely on the emergency room. But because there would be so many different insurance plans, it's complicated. It would be expensive. I mean, it means doctors and hospitals would have to keep rooms full of different insurance forms and insurance plans. And this is a fundamental problem in American healthcare and in Colorado healthcare, just the complication of having all these different insurers. I was on the board of the University of Colorado Medical School at a time when we were moving our campus from downtown Denver out to Aurora to Fitzsimmons Army base. The U.S. government the Army closed Fitzsimmons, and they gave it to the University of Colorado to build a new campus for the medical school, which we did. I don't know if you all have seen it, but it's a beautiful facility. It's fabulous. It's big and has room for hospitals and classrooms. It finally is the space we need. And we were building this new campus while I was on the board, which was kind of nice because what happened was every couple of months, they would open a new building out there. And of course, they'd invite the board out to clip the ribbon, and then we'd have wine and cheese and kind of canapes. It was very pleasant every couple of months. And we did this so often that it was kind of hard to keep track of what building we were opening. Gee, was this a new hospital wing? Was this a classroom? And one day I went out there for one of these openings, and we opened a big six-story building on the campus. And, you know, the dean cut the ribbon and we were sipping wine and eating canapes. And I said to the dean, hey, what are we going to treat in this new six-story building? What's it for? He said, treat. No, we're not going to treat anybody there. That's the billing office. The University of Colorado Hospital has 175 people in the billing office because they have so many different payment schemes and so many different rules. This is the problem with a mixed system where you have many different insurance plans. The administrative costs are terrible. So our scholars found that while this would work and would cover everybody, it would be difficult administratively, and it would actually cost more than the current system in Colorado. And then they looked at the third model, which was a single government insurance plan covering everybody up to age 65, where everybody's covered by the same plan. And they found that that would have the medical benefits I discussed. It would cover everybody. People could get into the doctor early. They wouldn't have to use the emergency room. It would basically eliminate the problem of medical bankruptcy. Nobody would go bankrupt again because of medical bills, which has been a serious problem in our state. It would be vastly simpler administratively because doctors, hospitals, chiropractors, labs would only need the one form. There'd be one set of rules and one form that they could deal with. They'd deal with one payer. And get this, the universal plan, the single payer universal plan would save money. It would actually save billions of dollars. Let me just tell you the numbers that they came up with. They said that in our current system, which as I said, leaves hundreds of thousands without coverage, Coloradans are paying about $38.3 billion per year in insurance premiums and medical bills, 38.3 billion. If we did the mixed system with most people on private insurance and some people on a government plan, that would cost between 38.6 billion, slightly more, to 39.34 billion, a little bit more than what we're paying now. Get this, the single universal healthcare system would cover everybody and would cost 34.6 billion. That is about $4 billion less, about 11% less than we're spending now. So I was very excited about this. When they came back with this study, I thought, whoa, this is great. And here's why. You know, the state of Colorado, like all states, I'm sure La Plata County government does too, they regularly create these study groups and special blue ribbon commissions and task forces to study some state problem, you know, water or wildlife or highways or whatever. And generally, those study groups, they always end up the same way. The study group comes back and says, hey, great news, we could solve the problem. We got a solution. All we need is for the legislature to authorize an additional $10 billion next year, and we'll solve this problem. And of course, that never works because the money's not there. But our task force said we could solve the problem We could cover everybody. This would improve health statistics. It would increase employment in Colorado and save billions of dollars. Now, to me, that's a fabulous result. So when they came back with this, I rather naively said to my fellow members of the task force, I said, whoa, the legislature is going to love us. They're going to love us. We solved their problem and we saved them money at the same time. We're heroes. And a woman who works for an insurance company who was on our task force said, no, because they're going to catch hell now from the insurance industry and the hospital industry if they try to do this, because it's going to be very controversial. You remember I said the expert report said that the single payer universal system would increase employment in Colorado, but they had an asterisk on that and said, well, it would decrease employment in the insurance business, which is clear because we'd be replacing the private insurers with the state plan. Overall, employment would increase largely because people would be healthier and could go back to work, people who can't work now because they're sick or injured. But in that one industry, employment would go down. So what we're looking at now is we presented this report formally to the legislature on September 1st, as required by the statute. And in January, when the legislature comes back, they're going to have to deal with this report. And I think it's going to be a serious battle. Here they have a study team, experts, who say we could solve a big problem, we could increase our state's population health, we could increase employment, and we could save Coloradans billions of dollars. But to do it, you have to create a state-run single-payer health insurance plan. And that, of course, is going to be controversial. The insurers don't want it. They're doing great in Colorado. And the hospitals don't want it because they know that a single-payer plan would have a lot of negotiating clout and could force them to reduce those high prices they make us pay. So there's going to be, I would say, a battle royal over this task force report. Yeah, socialism horror, says Carol McWilliams. It's not socialism. I just want to point this out. What the experts recommended is not socialized medicine, if anybody happens to ask you. The doctor is private. The hospital is private. The lab is private. The PT, the medical device company, the chiropractor, they're the same private providers we have today. This is not government providing healthcare. This is government providing the insurance for healthcare to replace a system that doesn't work and is very expensive. So I would, if somebody says to you, this is socialized medicine, I would answer you, no, it's not. You want to see socialized medicine. There are a lot of countries you can see it. Great Britain, government owns the hospitals, the doctors, the nurses, the lab technicians, they're government employees. And when you go to the hospital there, they treat you. We lived in Britain. I got great care there. And when you walk out, guess what? There's no bill. There's no bill. In fact, when my wife was in the hospital for about 4 days in Britain, had surgery, this would have been a $40,000 bill in the United States. When we walked out, they very apologetically said to us, you parked here the first day when you dropped your wife off, that'll be £5. So 4 days of treatment and surgery in Britain cost, but that's socialized medicine. That's the government providing health care. This is not what we're doing here. We are just setting up a more efficient and fairer system of payment to private providers. So that's where we stand. And I have been saying to Democrats, to everybody around the state, let's do this. What's wrong with improving healthcare, increasing employment, eliminating medical bankruptcy, and saving billions of dollars? It's a good thing to do. And of course, if we did it and made it work, which I think we could, we'd be a model for the rest of the United States. We could show the rest of the country how to do it. So that's where we stand. The report has been sent to the legislature. Of course, they're not in session now, but in January, they come back. The health committees in both houses will take up this report. And what I am asking as a member of the task force is that the legislature put this on the ballot, refer it to the people of Colorado and say, hey, do you want this new healthcare system that will improve healthcare, get you coverage, let you choose your doctor, and save us all billions of dollars? I'd like to put the legislature on notice. Let's take a stand. Do you favor increasing healthcare for everybody and saving money, or are you against it? And as I say, I think there's going to be a big fight about this because the insurance industry and the hospital industry, they like the current system. They're doing great in the current system, even though it doesn't work that well for many Coloradans. So that's where we stand. Thank you so much for listening. And if you see a member of the legislature, tell them, hey, when you get this report, let's cover everybody and save billions at the same time. Please let them know. Thanks.
Okay, let's go ahead. Karen, can you start with the questions? I see we have a number of them.
Yeah, I think the first one is about 20 minutes ago. Jen Phillips asked, what percentage are the underinsured and uninsured? What's the total population of Colorado? It was answered by Carol Keir, put 5.7 million in the state. And then Dick White said, if we had 6 million total, the figures, oh, I'm sorry. Maybe I should just let you ask because I'm not sure which figures you're talking about. So what percentage are the under?
It's in the range of 6% are uninsured, in that range. And if you include the underinsured, you get up to about 18% of people who most of the time can't afford to go to the doctor.
Yeah.
Or at least they're not going to get any help from insurance.
And let me ask a question just real quick on that. It seems to me that that hybrid plan would not eliminate the underinsured if you've got people that are still buying private insurance or getting it through their employers. Is that correct?
Yeah, I think that's right. Unless you said to them, you could say, for example, anybody with a deductible over, over 10% of their household income can join the public plan, which presumably would have lower copays and lower deductibles. But yeah, you're right. As long as people had a plan with their employer that had a $4,000 deductible, they'd still have that problem in the hybrid plan. I have a friend in Denver who's 63 and just left employment, and she's got 2 years to go before she gets on Medicare. So we went online. I'm the healthcare expert, so she asked me for help, and we went online to buy this healthy 63-year-old single woman on a policy. The cheapest policy we found was $650 a month and a $6,000 deductible. That's what you're facing. So that person would really benefit from getting on a state plan, either in the hybrid system or the single system.
Okay, Karen.
Okay, Pat Herndon, who's on here, is a medical provider, and she wrote a big long comment in there, not really a question, but if you could pick out something, TR, in her comment on the chat about
let me find it.
health, fee for service.
It was at 1229.
Yeah, I see it. Okay, all right.
I think she's saying no one mentions fee for service financing of access to medical care, which creates a dynamic of whatever the market will tolerate. So that wouldn't work either.
Yeah, so I don't see the chat, but the point of fee for service is it tends to increase costs because it encourages the provider to provide more service. She gets paid every time she does one, whether it's really essential or not. That's what the experts say. But it's hard to change. It's been the system in the United States forever. And I think our experts, when they studied the different plans, decided it would be too big of a push to try to change who the providers are and how they bill. They just looked at the payment system, at the insurance system. Now, if you have an insurance system that covers 5.7 million people in Colorado, or really it would be about 4.8 million because we're not covering seniors in this plan, it would have the clout and the power to do something about the fee-for-service plan, to pay for outcomes or to pay for a whole episode of disease rather than individual services. But our study didn't look into that, and it's an important factor. It's something important to look at.
Okay, the next is Jan asks, how did the conservative task force members react to these results?
Well, the leading Republican on our task force was State Senator Jim Smallwood, who lives in Castle Rock. And he was the obvious choice for the Republicans. He's the leading Republican voice on healthcare, and he really understands these issues. He really gets these issues. Here's what happened. Once he saw the direction, well, I don't know exactly why, he just stopped attending. He just stopped being part of the task force. And maybe it's because he saw the direction that our experts were headed. As I say, it wasn't surprising. All studies eventually end up with the notion that a single payer plan covering everybody is the most efficient and most medically effective way to go. But he just stopped attending. And then we had a woman in the insurance business, and she tried pretty hard to, what should I say, to undermine the study. So I told you that they said the current system is costing us $38 billion a year, and the single payer system would cost $34 billion a year. And this woman said, why don't we change that to say would cost $34 billion a year, or maybe much more. They didn't find much more, but she tried to put that in there. So they were fighting it, but I will say in the end, that woman did go along with we had a unanimous report that went along with what the experts said, but they did try to fight it. And the other issue was, I told you there were 4 people from state government agencies, and they were quite worried about being on a task force that recommended something that clearly is going to be controversial in the legislature. They were edgy about it, and maybe we shouldn't say it's a recommendation and like that. And the answer to that was, look, we hired these experts. This is what they told us. It's not, you're not saying it. We're just telling the legislature what the experts said. But they were a little antsy about it. And then I told Jared Polis what the task force found, and he said, yeah, that made sense to him. He's thought it for a long time, but Jared's up for re-election in November, and so far I haven't seen him jump all over this plan and say he's going to support it, but maybe he will. I hope he does. I've urged him to.
Okay, and the next question up is from Dick White, and he had 3 questions, which, can you see that, TR? It was at 12:35 in the chat, so it's not too far.
I'll get there, hang on.
And for people on their phones, if there's anyone, how do you get the legislature to overcome the lobbying? Wasn't that the question? So that's the first question.
Yeah, it's hard. In my book, have I mentioned my book, Makes Great Christmas Giving for Your Mom? In my book, I kind of, this is a little snide, but I said, the hospital industry has made huge investments in healthcare, and that's true. But maybe the best investment they've made is in buying congressmen. They make huge contributions to members of Congress from both parties to fight any significant change. And I then addressed the American Hospital Association, and they were all ticked off at me for this snide comment that they invest in politicians, but they do. And same in Colorado, the health insurers and the hospital industry are major contributors to all members of the legislature, both parties, and therefore it's hard to take them on. And as I said, they have the benefit of the fact that we're the sixth healthiest state in the country. I mean, a lot of our numbers are really good. And they say, why do you want to mess with a successful system? So those are the arguments. I think the answer to that is to take this report from experts, not politicians, not lobbyists, a bunch of experts at the School of Public Health, and demand that our legislatures tell us, are you in favor of increasing population health? Do you want to decrease medical bankruptcies? Do you want to increase unemployment? And do you want to save Coloradans billions a year on doctor bills? If not, vote no. But I think I just hope we get to the point where we can make them take a stand on these issues. That would be the way to fight back the lobbyists. But as I say, it's difficult. These are very powerful industries in American politics. They contribute a lot of money.
And I think there's sort of two things that have to happen. One, the legislature's got to come up with an initiative. And then once that happens and it gets on the ballot, then the voters have to approve it. So I think that one of the reasons I'm so glad to have TR here is because we Democrats generally support universal health care. And we're going to have to put in a lot of work and raise a lot of money in order to counteract the special interests.
Yes, that's right. Now, let me look at the other Dick White questions.
He says, what gets covered for everyone?
Yeah.
Most affluent.
What gets covered? They didn't go into that, but excuse me. Generally, I think a system would be somewhat like Medicare, where there's a floor of coverage that everybody gets. Everybody gets the basic care they need. And then there are other elements of coverage that are not covered, breast enlargement, hair replacement, cosmetic surgery, perhaps, maybe hearing or vision or dental are not covered. And then for those, presumably the insurance industry would step up and sell supplemental coverage like they do for Medicare. And I think that might be a way to deal with the lobbying pressure. The insurers are doing beautifully on Medicare supplemental plans. They love those plans and they make really good money on them. And their customers like them, so it makes them popular. So maybe we could say the state single plan will have a floor of benefits that covers everybody. Presumably primary care visits, injury, serious illness, annual health checkups, vaccinations, things like that. And then there would be other stuff that would be covered. You'd have to go out and get a supplemental plan. But our study did not go into the details of exactly what those would be. But you can, if you just look at the way Medicare works, that gives you a sort of a basic idea of how that system would work. And then the third question is, how do you ensure that payments to providers provide a living for them, because Medicare does not? What our experts looked at was they looked at a range of reimbursement rates for hospitals, doctors, labs, chiropractors, et cetera. And they went from 100% of what Medicare pays the same to 250% of Medicare. And even at a range of 150 or 200% of Medicare, double Medicare rates, the state would save about $1 billion a year, maybe $1.5 billion a year with the single payer plan. If the state only paid what Medicare pays, 100%, that's where you get the $4 billion saving. If the state paid 250% of Medicare, the savings would be in the range of $700 or $800 million a year, not quite $1 billion. There'd still be a saving. So they looked at a range, and I think if you talk to doctors or hospitals, they all tell you that it's hard to get by on Medicare reimbursement rates. They need to charge, they want to get more than that. And our experts said, yeah, even if we pay double Medicare or more, the state would still, Coloradans would still save money. So we could do that. We could provide more than what Medicare pays. I went to the hospital in Montrose a few years ago and was talking to them, and they told me that if they could get 150 to 170% of the Medicare reimbursement, they'd do fine. They didn't even need 200%. So the plan, I think, contemplates paying significantly more than Medicare does.
Okay. Next question, Connie asks, why are women the ones who use hospitals the most?
They get pregnant. They're less likely to brush off a minor disease. They're smart. They go in when they first get the disease, whereas guys are tough and, a minor pain in my abdomen. And I don't think that's going to be an infected appendix. It's not going to be boom, then you have a burst appendix. So I think traditionally, well, for many years, but all the studies show women go to a doctor, go to a lab, go to a hospital, a chiropractor, significantly more than men do, maybe a third more, partly because of pregnancy and partly because are they smarter, or they're just more willing to go get treatment when they first sense that it's needed. And I'm a guy, if something hurts in my body, I tend to say, well, maybe it'll go away, and sometimes it does, but maybe it doesn't.
Okay, the next one from Jeff Dolman. Every time we talk about healthcare reform, the industry airs ads containing lies and fear mongering. Why is there no advocacy on air and media to refute these lies and explain the benefits of single payer? I know one answer, no money. So how do we get the Democratic Party to step up?
Yeah. Well, I hope here, I think this task force, this experts report really gives us momentum. I mean, it really gives us a tool to go to our legislators and our governor, our cabinet heads and say, hey, look, this is proven. These are our experts, and they said we could save billions of dollars. Are you for it? And don't let them skip away. Don't let them say, gee, I'll think about that, or I need to study. No, the study's been done. It's been given to the legislature. So I've already told my legislator, happens to be the Speaker of the House, incidentally, my local rep, vote for this. Let's do this. Let's save billions and improve healthcare. And I think we have to do that. The health insurance companies, here's what they're going to say. They're going to say, oh, gee, this puts some government bureaucrat in your doctor's office, right? Government's going to dictate what your doctor can do or what pills you can get. That's what they're going to argue. Well, currently, the person dictating what your doctor can do is United Healthcare in Minnetonka, Minnesota. He's got to call Minnetonka, Minnesota and ask them if he can give you the pill that you definitely need. I think it's better if the payment is local and run by people in Colorado whom we get to elect. So that's one answer. And then the other argument they're going to make is, oh God, this is going to be a big tax increase. Because when people, if they're paying a premium, their medical premium to United Healthcare or through their employer to Aetna or Cigna, well, that's kind of a cost. I'm paying a private company. If you're paying the government for health insurance, it feels like a tax, even if it's less and even if the coverage is better. So this is the argument they always make. Oh my God, you're going to raise taxes. Well, if I have the choice between paying $400 a month in insurance premium or $280 a month in taxes for a government plan, I'm better off with the government plan. But they think maybe people are so averse to taxes and so anti-government that just that argument is enough. So those are the things they're going to say. I don't think they're valid, but as the questioner said, they're going to have the money to make those points.
Okay, the next actual question probably comes from Jeff, but Pat Herndon had a comment at 12:45
Yeah, okay.
about public operated medical system versus universal access medical system. I don't know if that's a different thing, but anyway, she said a public insurance system would be a transition to a universal access public care system.
Yeah, you can make the argument for it. In many countries, publicly run medical systems where the doctors work for the government and the labs are owned by the government, they work. I'm a US Navy veteran. I use the VA as government doctors, government nurses, government lab techs in a government hospital. They're great to me. They call me lieutenant. I haven't been a lieutenant for like 50 years. They call me lieutenant. They treat me. They care. You have to wait. You have to sit around waiting, and then you walk out. They give you the pills, and there's no bill. I mean, to me, I think that system works. And when I'm sitting in the waiting room, there are all these 28-year-olds who are in Iraq or Afghanistan there, and I say, this is socialized medicine. VA, this is socialized medicine. Oh God, no, I wouldn't touch that crap. No, not a chance. But it is. It's government-run medicine, and it works. We didn't broach that because it's too big a step. I think politically, it's too big a step. Just saying government should provide the insurance is a big step. So we didn't take that next step. But as a matter of fact, I believe, and I think most of my fellow veterans believe, that at the VA, at least, government-run medicine is working pretty well.
Yeah, it's a lot better than it used to be.
Yeah, I agree with that.
question-
Yes, it used to not be that good. Yeah.
So the next question from Jeff is, so your proposed plan goes up to 65 and then Medicare takes over. And
Yeah.
again, is just a vision for the future that hopefully you'll include everybody at some point. But if Medicare patients are excluded, that will leave seniors without comprehensive coverage like dental, vision, and auditory care. Why can't a single payer healthcare system include seniors, since that population is small and the added cost won't cause the total cost to be more than the status quo in the mixed system? Will seniors be reluctant to support it?
Yeah, that's a good point. I hope seniors are not reluctant to support it because they're not in it. I hope that's not the case. I think the reason our experts did not include seniors is because they're expensive. They get sick more, they have more serious illnesses, they spend more time in the hospital. And if you have a plan, a highly popular plan, Medicare has the highest rates of satisfaction of any insurance plan in the United States. So if you have a popular plan already that's going to pick up those costs, why should we include that in the state? I think it was just a purely practical economic decision they made, and it makes sense to me. And so then, will seniors not support it? They say, well, why would I be for that? It's a state operation. I don't get anything out of it. Well, your kids do. Your grandchildren do. Doggone it, your neighbors finally get care that they're not getting now. I'm a senior. I would support it. So I hope they do. But yeah, I understand that question.
And I see the difference there as state versus Colorado trying to start the ball rolling, and Medicare is federal. So I can see why your task force didn't jump in on that.
Yeah, on the other hand, if we do this and it works, and everybody's covered by a single plan in Colorado, and people say, gee, this is pretty good. It's a lower premium and I get more choice than I did before. It's not bad. Maybe that would encourage the federal government to expand Medicare to everybody, that is, to follow us. I will make this pitch. I think a very good way to solve big national problems is state by state. And a lot of the major policy advancements in American history happened in one state. One state was the first state to outlaw slavery. Massachusetts was the first state to have free public education for everybody. Now, of course, everybody does. Female suffrage started in Wyoming. Utah and Colorado were the next two states. We had women voting 40 years before those snobs in New York and New Jersey got around to it. Minimum wage laws, child labor laws, and of course, interracial marriage and same-sex marriage. They started in one state and the other states see that it works and these ideas spread. And that's one of the reasons I really was pleased with our task force report, because Colorado could be the model for the whole country. We could show the country that this works. At the moment in the United States, there are about 30.5 million Americans have no health insurance. That number is higher than when President Trump came into office, because he took some people off of insurance. If a state could get decent coverage with decent choice at decent prices for everybody, I think other states would follow it.
And I think California is right on the cusp. So all we need is California to follow us.
That would be great if they do it. Yeah. Yeah. And Oregon is close. They want to do it.
The next question.
Oregon sent a guy to find out about what our task force said. They're going to take our results back. And in fact, I wrote a column about the task force results for the Denver Post. It ran on September 5th. And the Portland Oregonian ran that column so that people there could see. So yeah, I think other states will follow if we make this work.
So the next question, what happens if Colorado introduces single payer and you travel out of state? Who covers you? Will Colorado pay providers or hospitals in other states?
Yeah, I think that would work the way insurance plans work now, which is if you get sick or injured out of state and have to get care, either a doctor or a hospital, your in-state insurance will cover you for a certain amount of time until you can get back to Colorado. You can't go out of state to get some optional treatment. But if you're injured or sick when you're out of state and need care immediately, the plan covers. That's how, Colorado-based private insurance plans work now. And I think that's how the state plan would work.
Okay, I don't know if we have any other actual questions. People are saying they support it. I'm going to save the chat on here. So it's a great chat. There's a link in here that Elaine Branyard, I'm not sure how you say your last name, the 2020 Colorado Democratic Party platform, healthcare, on page 16. So.
And I'll go ahead and when I send out the link to the recording, I'll go ahead and put the link to the report and the summary.
Yeah, good. Yeah.
The report's pretty long and detailed, but I think if you read the summary report, you will at least be able to get a pretty good idea of what's going on. And TR, I'd like to ask you, what lessons do you think we learned in 2016 with the Amendment 69 campaign that might be might help us to do better at getting public support for this?
Yeah, well, the positive lesson I learned was that there's great skiing at Purgatory, because I went down to Durango to campaign for Amendment 69 and skied Purgatory at the time, which was great. It was beautiful. The lessons we learned in 2016, we put an initiative on the ballot that would have created a state-run single-payer insurance plan. I'll tell you how that came about. It was a bunch of people that I tend to consider hopeless, idealistic lefties in Boulder, which is they say the communist county of Colorado. It was a bunch of lefties in Colorado who came up with this plan for a state-run single payer that would cover everybody and give you your choice of any doctor or hospital. And I believe I've mentioned that I wrote this best-selling book on healthcare. So they came to me, I'm not in Boulder County, and said, "Can you help us?" And I said, oh, come on, it's hopeless. It takes 96,000 signatures to get on the ballot. This group had no money, no operation, no campaign people. I said, nice idea. Thanks for trying. Good luck. And they came back to me about 2 months later and said, we got 154,000 signatures. And the reason was when they presented their plan to people all over the state, people said, gee, that's better. That's better than what I've got now. So we did get it on the ballot, and we campaigned. I went to, I think, 55 of the 64 counties to campaign, including La Plata, which was great. And it turns out we had a few problems. One is there were flaws in our plan. There were several flaws in our plan. One was we in Colorado, if you're going to spend money, you have to say how you're going to do it. And we had a tax on income, and everybody with income had to pay the tax, but we didn't cover people over 65. And so everywhere I went, I would lay out the wonderful charms of our plan, and people would be kind of reading the brochure and say, wait a minute, I'm going to pay for this and I'm going to get nothing. That was not a well-designed plan. I think we could have done that much better. Second, our plan said no deductible, no copay, no deductible. You pay for the insurance, but after that, nothing. And people didn't believe it. They said, that's too good to be true. How can you do that? It'll never work. And I think they were probably right. I mean, we hadn't worked out the financing. And then the third thing was, as will happen again next year with our task force report, the insurance companies ganged up on us, and the insurance companies poured $6 million into Colorado. The Hospital Corporation of America put in another $1 million. Big Pharma put in another $1 million. So they had $8 million to spend against Amendment 69. And I don't know if you remember, but they had some very funny TV ads where this woman is in her doctor's office, and a government bureaucrat in a suit walks in and says, wait a minute, you can't do that. It was a pretty funny ad. We were just vastly outspent by the interests that were against this plan. So I think we learned we could design the plan better and make it more believable, and then raise more money are the lessons we learned. The beauty of this system, having had a task force, is that it's now going to go right to the legislature, and we can ask the legislature to refer it to the voters, which means we don't need the 150,000 signatures. It saves a lot of money and effort, which we can pour into a campaign. So this system is better. And also, this plan, as designed by our experts, doesn't have that level of detail. It just says government's going to cover everybody and we'll figure out how. And I personally think that's better, because every detail you have in there gives the opposition something to shoot at.
I want to bring up Dick White's comment. He voted no on Amendment 69 because healthcare is too complicated to embed in the state constitution. Now, I remember hearing that. It needs to be in legislation that can be amended to address the inevitable glitches.
Yeah, that was another problem we faced, and I think that's a legitimate argument. My answer to that always was, hey, healthcare should be a basic right, and basic rights should be guaranteed in the state constitution. But it wasn't that great an argument, and I see his point. Why do we want to stick it in the Constitution? We should have done it by legislation. As I said, the basic idea, I think, of Amendment 69 was right. Let's cover everybody, and let's have the state do it with a single system that'll save money. But the plan had a lot of flaws when you got into the nuts and bolts.
Okay, one last question.
Karen,
Jan has a question.
Yeah, I know. And that was the question I was going to ask too. So she says, what's the plan to pay for the task force's single payer plan? And I don't think there is one because that wasn't really laid out in terms of the tax and so on. But what I'd really like to hear you talk about for just a minute, TR, is what's the go forward plan? Where does this go? What can we do those of us who support universal health care, who's going to lead the charge? Just kind of talk about, whatever you know about that.
Yeah. First question, how are you going to pay for it? You'll pay a premium. You'll pay an insurance premium. And the theory is because of the administrative savings and because of the negotiating power of a single plan, even if we're paying 200% of Medicare rates, the premiums can be lower than what we're paying to the private insurers now. So presumably that's how it will be paid for. People will pay a premium to the government plan. What happens next? As I say, in January, the legislature comes back. Both the House and Senate health committees will take up this task force report. I think we can be certain of that because they're run by Democrats, and the Democrats from those committees were on the task force. Representative Emily Sirota of Denver she was the sponsor of this legislation, and she's determined to see that the legislature take it up. I think one possible tactic from the other side, from the industry, will be to try to just shelve it. Just say, just another 90-page government report, put it on the shelf, ignore it. They don't want the legislature to have to vote on this. They don't want the legislature to see what our experts concluded. So they're going to try to push it aside. And I think therefore it's in our interest when we talk to a legislator to say, hey, be sure to look into this new task force report that's going to solve a big problem in Colorado and save us billions of dollars. Don't ignore it. Just make them take it up. I think if they take it up, it gets hard for them to vote against it. And that's why somebody in the insurance industry said to me, another 90-page government report, there are a million of them. No, who's going to read that? And I think that's going to be their strategy. Let's just push it aside and forget it. And it's our job, at least those of us who believe that we ought to provide healthcare for everybody, to make sure that the legislature can't forget it, that they have to deal with what our own experts from the Colorado School of Public Health have told us we could do.
And what do you see that we Democrats, around the state can do to push that forward, other than just talking to our legislators? And hopefully we will not only talk to them, we'll send them letters and phone calls, and we'll put a lot of pressure on them to make sure that they do take this up. Are there other things that the county Democratic parties can do?
Yeah, when some state senator or representative comes to this meeting, ask them about it. Put them on the spot. Say, come on, are you going to support this? This is a good idea. Letters to the editor, go to their town hall meetings. I have the email addresses of my state senator and my state rep, and I've emailed both of them and said, hey, did you notice this? And write columns for the local paper. I think the Paonia paper ran the column I wrote for the Denver Post. The Denver Post did, and I think the Boulder Camera did. So columns there, legislators read those, people read them and talk to the legislature. Whenever, when you run into them, buttonhole them and say, hey, this sounds pretty good. Solve a problem, save billions. What do you think? Let's do it. So I think that's the way to do it, is just don't let them ignore it, or don't let them say, oh, gee, I haven't looked at that yet, or I'll try to get around that. They don't have to look at it. Here's a plan that improves healthcare, reduces bankruptcy, increases employment, and saves billions. That's all they have to know. So you don't have to read a 90-page report. That's what I would say to them.
Do you have anything else, Karen? Is that
There's
it?
no other questions, but Pat Herndon also said the medical risk in the US is much higher than other developed countries, talking about having a public direct delivery system is the best way to identify medical risk and eliminate it.
Yeah, I'll go along with that. That's true compared to other really wealthy countries. But one reason medical risk is higher in America is because we have all these people who can't go to the doctor. As I said in my book, I've said a million times, all the industrialized democracies in the world, all the advanced free market capitalistic democracies, there are about 35 of them on the planet. Western Europe, Japan, South Korea, Australia, New Zealand, like that. All of them provide healthcare for everybody. They just think it's absolutely basic. And when I was doing my book, you know, I would go around, I met with prime ministers, I met with health ministers, economists, and I would say to them, gee, why do you provide healthcare for everybody? And they always said the same thing. They said, why don't you? You're the richest country in the world. Why would you leave tens of millions of people with no health insurance? That's one of the reasons we have more medical risk. We have more medical costs because we leave people without coverage. Our task force has said there are enormous benefits from covering everybody. And if the United States did that, it would reduce what's known as medical risk. It would reduce our costs.
Okay. You know, TR, we really want to thank you for taking the time and coming and talking to us. Let's everybody give TR a big virtual round of applause. And hopefully we can stay in touch and be planning on how best to push this forward.
Will do. Thank you very much. Thanks for letting me talk about it. Appreciate it. Thank you.
As I mentioned earlier, next month, County Commissioner Marsha Porter Norton will be our speaker, and she's always an interesting speaker. I don't think there were any other announcements in the chat. Were there, Karen? You got one?
No other announcements, but we have the school board elections coming up. So everybody that's on here, it is crucial that we get involved in the school board issue here. The League of Women Voters has a forum coming up on the 14th. And if you guys are not in Durango, then there's Ignacio, and League of Women Voters anywhere would have all the links to the local school boards. So I urge everyone, get involved, go to the forum, and vote for progressives.
Okay, thanks everybody. We'll hope to see you next month. And again, I'll get an email out as soon as the recording is available, and you can certainly feel free to pass that around and let other people know about this meeting. And I know I had quite a few people who said they couldn't make it, but they really wanted to see the recording. So again, thanks TR, and we'll see everybody next month.
So long. Thank you.
Bye.